And so there's the skills piece, and then sometimes it depends on how people's inner psyche wants to direct it. So some people will rewrite the story and go back into some period of time and just using their sort of active imagination in terms of like, how do you change the story or how do you rewrite it? Sometimes people gain more insight about the different roles that people play. So it's a very compassion building experience for some folks. If folks were in a victim state and they're sort of reflecting on their perpetrator was, they might have some insights in terms of like what was going on in the perpetrator's life at that time, and having compassion and insight for that, which can be really deep and beautiful at the same time. Sometimes people will just put it more in a mindfulness based place where they will know what is a deeper felt sense in their body of what calmness is, and then just work on cultivating practices that can reinforce that state. So it's this piece too, where in the more classic MDMA assisted therapy for post-traumatic stress, we're trained to not be directive and allow actually the individual have their own capacity to lead what they need in terms of their healing modalities. And so this lines up really well with motivational interviewing, which is a framework that we use in family medicine a lot to help people with behavior change. And is that the individual is really their own inner expert, and it's really creating space for them, one, to address, like to find health and compassion and hard parts of their histories, and then connect to what we might call their own innate healing intelligence. And so in some psychological frameworks, we call it the big S self. In that, like, what is their inner directed healer going to say, this is what I really need to do next?